Hey students, I am doing a video for how you are going to be managing your patient on the day of for the charting that you're going to be doing. So again, we're going to be going to the clinical care station. That's going to open up. Now, I'm in Paragon Test, but yours is going to read the live version, but that's not where I'm at right now. So I'm going to go ahead and log in. As you're logging in, just keep in mind that everything is case sensitive, including your username. That took me a second to figure that out. All right, so as always, we're going to be going into Care Glance to take care of our patients. And it's going to ask me to assign my patient because it's looking as if I logged in for the first day. So at this point, I'm going to go to my location, which I'm going to use 3 North, but yours is going to be wherever it is you're working, and enter. That's going to pull up my patient list. I could have done that, or I could have used the green arrow. Regardless, my patient list is pulled up. Now, I'm going to act as though we are seeing this patient and we are getting ready to put in our morning vital signs. So I'm going to go to that flow sheet. And remember from pre-planning, oh, you know what? I didn't select a patient. So I'm going to go back out of that. So I'm going to select Miss Christy Moore as the patient I'm working with, and then go to the flow sheet. I had to select that patient first. That's going to bring up the flow sheet. Remember, your flow sheet has your vitals, your pain, your I's and O's, measurements, and IVs. So we are going to do a set of vital signs. We're going to put in those vital signs that we did in the morning. So I'm going to right-click, which is going to pull up that tab, and I'm going to do a new vital sign entry. Now for my group, before you put any vital signs in the system, whether they be normal or abnormal, you're going to clear them with me. I want to see those before you enter them. And then here you've got temperature, heart rate, respirations, oxygen sats, and blood pressure, height and weight if you're doing it. And then after you put those values in, I'm going to pause it while I put the values in. All right, so I'm putting in my vital signs. It's going to read at 10 o'clock in the morning because that's the time that I'm doing it. And that's when you're going to do it too. You're going to take your vital signs. You're going to come find me if you're in my group, or your nurse. Well, for me, I want to know all the vital signs before they go on the computer. Temperature 98.2 Fahrenheit, and it was done orally. Heart rate 62, and it was regular. Respirations 14, and they were even. Oxygen sats 97%. This patient happens to be on 4 liters per minute with a nasal cannula. Blood pressure is 120/72 in the left upper arm. And after I get that done, I'm going to go ahead and click OK. That's going to put that vital sign on the flow sheet for the time that I did it. Now what I forgot to do, and it's on the same tab, and you can see the scroll down right there, is I forgot to do my pain score. So my pain score would go in there too. So let's say they had I'm going to pause this. In this case, the patient had a pain of 4 on a numeric score in the abdomen, upper quadrant, and position was anterior. And then, of course, I'm going to click OK to put that in. And you can see it's recorded. And then that was just recorded at 10:23, and there was the vital sign set that I just did. So now I'm going to do an I and O input. So I'm going to right-click, New I and O entry, and that's where we're going to put the information. Oral intake, you're not going to be doing anything else besides for intake. Unless you're doing a tube feeding, and that's up to your professor. And then there's where you're going to put output: urine, bowel movement, liquid, NG tube, or Foley. So that's how you're going to record those. So in this case, the patient had an oral intake of 250 milliliters. They had 750 milliliters of urine out, and I'm going to enter that. And you can see it recorded at 10:27 of 250 in, 750 out, and that's going to be in the system. You'll also note, you see the two yellow columns, because I did one a minute ago. We had 250 in plus 250 in, output 750 and 500. So if you look over here, you can see the shift intake was 500, shift output was 1250 for a deficit of 750 on board. So they're outputting more than they're inputting. That's a nice little feature for the shift. The next thing you're going to be recording is their food input. So you go to measurement, right-click it, new measurement. Then there you have the percentage of their breakfast. You'll be doing these as they happen. So you'll be doing breakfast and lunch that you'll be measuring. And all of those measures were done in the flow sheet. So I'm going to leave the flow sheet area. All right. And I've still got my patient selected. If you don't, this isn't going to work. I'm now going up to the area that says perform assessment. And we're going to do a daily assessment. And it's going to ask you for the date and time, so we're going to do that for now. Now this gets really interesting because you see there it says, I'm glad it did this, you see there where it says unit type, you don't see the tabs that you want, and there's a reason for that, because we're in the wrong unit type. So I'm going to show you how to change that. So I'm going to go up here, I'm going to X out of that because I don't want to do that. Sometimes when you're doing this, if another unit has grabbed your patient, you're going to have to switch it back. And you go to change unit type. And we're going to go to med surg. Okay. Now look what happens and what tabs I have when I go to perform assessment. Daily assessment, because you're not going to do an admission. And okay. Now look at the tabs you have that come up. Much different than what we saw just a moment ago. So now we're in the correct area for performing the assessment. So we're going to go to the ADLs tab. And that is where you're going to document your AM care. So we're going to check a few things. I'll be back in a second. Now I filled out a couple things. I'm helping my patient this morning. And the patient is resting in chair. For oral care, we assisted them with setup because they were able to brush their teeth on their own, but they needed help. They're able to ambulate with help for this particular patient. Patient has bathroom privileges. And they were unable to bathe self, so that lets everybody know that we had to help. And the patient uses a walker. And they need assistance with eating and drinking. Now, what's really weird about these assessments is that when you do it, when you're done, the way that you save it is you hit your back arrow. And then it's come with this. Do you want to close this assessment? Yes. And that is going to save the assessment. I get it. Now, we've saved that assessment, and a way that you could know whether or not it took is you can go up to these three little guys up here, encounter management. Click on that. And then we are going to get the encounters. My name is in here. I'm looking for all the encounters with my name on it. This is where I'm going to co-sign, where your professor is going to co-sign your encounters. I'm going to double click on that. This will be your name, and I'm going to look at your assessment, your ADLs. That's where I'm going to see it. So the things to remember while you're in here is don't forget that sometimes you might need to change your unit type to make sure that nobody else grabbed your patient, like respiratory therapy. Make sure your patient is selected before you're trying to do anything. That flow sheet is where you're going to be charting most of your stuff, most of your items. And you're also going to be doing perform assessment. And don't forget, when you're done, exit out. And always leave the system if you're going from one room to another, using the door. Otherwise, it might still see you in the system and it won't let you log in at another spot. That can happen. And that's everything that you need to know.